Today we're talking about an exciting new treatment, Zepbound, also known as tirzepatide, a once-a-week injection for weight management and obstructive sleep apnea. My patients have lost a lot of weight with Zepbound, so it is very effective. Zepbound is a prescription medication given once a week by injection under the skin. It's approved for chronic weight management and for treating moderate to severe obstructive sleep apnea in adults with obesity. But it's not a magic bullet. You still need a reduced calorie diet and regular physical activity. Zepbound is a dual-acting medication. It activates two receptors, the GIP receptor, the GLP-1 receptor. Together, these help regulate appetite, calorie intake, and blood sugar metabolism. In simple terms, it helps you eat less, feel full sooner, and process glucose more effectively. Everyone starts at 2.5 milligrams once weekly for the first 4 weeks. The dose is then increased in steps of 2.5 milligrams. For weight management, maintenance doses are 5, 10, or 15 milligrams once weekly. For obstructive sleep apnea, the recommended doses are 10 or 15 milligrams once weekly. The maximum dose is 15 milligrams per week. Clinical trials show Zepbound leads to significant weight loss, mainly by reducing appetite and calorie intake. People lose more fat mass than lean muscle. It also improves insulin sensitivity and lowers blood sugar levels in a glucose-dependent way, meaning it usually only acts when your blood sugar is elevated. Like all medications, Zepbound has potential side effects. The most common are nausea, diarrhea, vomiting, and constipation. Other risks include low blood sugar, especially if you already have diabetes and take other medications, pancreatitis, serious allergic reactions. It should not be combined with other GLP-1 medications. If you're in Canada, there's some good news. Patients can register at myzepbound.ca for potential discounts, making treatment more affordable. Zepbound is a powerful new tool in the fight against obesity and sleep apnea. But remember, it works best when combined with lifestyle changes like healthy eating and regular exercise. Always consult your family doctor before starting the medication. If you found this video helpful, don't forget to like, share and subscribe to Dr. GT channel for more evidence-based health updates. And let me know in the comments, would you consider Zepbound if your doctor recommended it?